Welcome to Politics Done Right. I am your host, Egberto Willies. This is the progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, conservative, or otherwise, you get to air your point of view. Remember, you can also send me a tweet to EGBERTOWILLIES. That is, at Egberto Willies. Let us engage. It is politics done right.
1, 2, 3, 4.
Well, folks, welcome to one more edition of Politics Done Right. I'm Egberto Willies, your host. Thank you so kindly for being a part of the show. We are going to have a wonderful show for you today. In fact, we have a great guest, a knowledgeable guest, somebody talking about healthcare who finally knows what they're talking about, somebody who understands the problems that we are going through in the entire healthcare domain. I think you're going to love the person that we have here today. Now, look. This is no joke, and there are a whole lot of things that we have to do. And you know we've been speaking about this for a long time, and you know my stance on Medicare for all and much more. The expert that I have on today has a whole lot more to talk about than just what we speak about when we talk about Medicare for all and all that kind of stuff. And I want to hear what he has to say, so I'm going to ask you all to give him a hearing on these particular issues. Now, this is going to be a dual show again, a very important dual show, because guess what? Well, I'll tell you what. I'll go ahead and start the show. Ed Eichhorn on fixing healthcare is the first segment, which Democrats should progressives support. Ed Eichhorn, founder of Medilink Consulting Group, will discuss healthcare costs and more, and I will break down who I believe progressives should support in 2020. It all ties together. Politics and healthcare are inextricably linked. Today's show covers both. Our segment features Ed Eichhorn. So who's Ed Eichhorn? He is a veteran medical products and services developer and founder of Medilink Consulting Group LLC, where he advises medical societies and commercial clients on marketing and strategic planning projects. During his 40-year career, he has been the director of research and development for a kidney dialysis company, helped to found an innovative, successful mobile medical testing business, has been a senior executive for a large chain of medical imaging centers with responsibility for sales, marketing, and strategic planning. He's active in his community and has served on his local school board. Anytime I hear about somebody serving on the local school board, I always like that. It means that they have very good social skills for 12 years and as a member of the board of trustees at his alma mater, Stevens Institute of Technology, for 3 years. He earned a bachelor's degrees in engineering and an MBA in industrial management. Eichhorn is the author of Healing American Healthcare, a plan to provide quality care for all while saving $1 trillion a year. And he made sure to tell me it's actually more than $1 trillion. He wrote that book in cooperation with Dr. Michael Hutchinson. In the second segment, we will discuss who progressives should vote for in the 2020, in my opinion, Democratic primaries, if we are to get the policies we have been championing for decades. I may even reveal my own pick, but I am not quite sure yet. I want to see how it's going to go. But without further ado, El Señor Eichhorn, how are you doing today, my friend?
I'm doing great. It's great to be with you this afternoon.
Well, look, I haven't completed your book, but there is one segment of my book which should tell every single one of our listeners today that you better get that book. And by the way, the link for that book is right there on my on the blog for the show today. But the one thing this man said is healthcare is a right. Welcome aboard, Ed. How are you doing today?
Terrific. Great to be here.
Well, look, it's great to have you here. First of all, tell me about what made you write the book that is going to save us $1 trillion.
Well, originally, Dr. Hutchinson and I talked about writing a book on healthcare in 2009, but we got busy with other things, and in the beginning of 2017, we read Paul Ryan's bill that he was proposing to change healthcare to basically eliminate Obamacare. the Congressional Budget Office said that within 5 years, 24 million people would lose their health care if this became law. And also, people who were between 60 and 64, their cost of health care could go up as much as 700% if that became law. So we thought Mr. Ryan was really talking about how to save money, not how to fix healthcare. So that was a big motivation for us to write a book that talked about how to provide care for everyone, but reduce the cost of healthcare in our country.
Now, there's a part of the book that was interesting, because what you said in the book is that, wait a minute, what they're doing is they're reducing the cost of healthcare, or reducing the insurance costs for younger people and increasing it for older people. Doesn't that defy what insurance is really about, that we all put into one pool so that whoever of us is unlucky gets taken care of? And we really shouldn't be talking about, we talk about it too much as a product, don't we?
Well, I think that's certainly part of the problem. You know, one of the things that we need to deal with in healthcare is making sure the networks of coverage, the people being covered, is large enough so that those people who are healthier are able to help cover the cost of those of us who are not as healthy and perhaps older. And that's one of the failings, I believe, of Obamacare, is that not enough people were in the system in the various states that had smaller networks, and it resulted in cost increases that really affected a lot of people, and the cost of care went up, and the deductible levels went up, and that made care unaffordable. Today, when Obamacare started, the concern was there were 50 million uninsured people in the United States, and it was important to put forward coverage for them in some way. But today, there are still 29 million people uninsured, and because of the change in the cost structure, another 40 million people are underinsured. So, people do not get the health care they need in a timely way, which makes their care more expensive.
Now, a part of your book had an interesting tidbit that kind of shocked me, where you said how unfair Obamacare was for the middle class, given that the middle class had this huge deductible and huge premium, $1,200 on average for per person, I believe, while it turned out that somebody at 138% of poverty, which means they're not in poverty, they just make X more dollars, only ended up with a $300 bill. Why don't you tell me how did that inequity come about?
Well, the idea was, as I understand it, that people up to the 138% of the poverty line could get their care subsidized by Medicaid, which is why 10 million of the people who got coverage through Obamacare fall into that category. The example we showed in the book about our concern about fairness was in the state of New Hampshire. And it was a family where a husband and wife worked. They had a family income of $80,000 a year. They had one child. They had an individual deductible of, I believe, $6,000 a person, and their monthly premiums were $1,200. Okay,
that's the one.
Yeah, and we just felt that there's a basic unfairness there. If I'm making 138% of the poverty line and my insurance is $300 a month, why would I want to get a better job? Because my insurance costs would go through the roof compared to what my operating budget was at that salary level. So we thought that was a real problem that got worse because of the lack of competition that actually evolved in Obamacare. When there are only 2 or 3 providers in a state, that works more like an oligopoly, so that the price competition is quite limited. And if the network is small, that means the costs go up on a per capita basis, as opposed to a network where you have a normal distribution of healthy people and people who may have healthcare problems.
Okay, I want to ask you first a few things about, because you made some comparison with different structures around the world. So what I want to ask you specifically is, are these other structures around the world really better than ours, worse than ours, on par with ours? Let the folks know from somebody who knows the reality about that.
Well, there's a great report that we reference in the book from the Commonwealth Foundation, and they've been doing this study for a number of years in 11 what they call high-income countries. And in that study, the other 10 countries either have essentially the German plan where insurance is paid for by employers, or they have a general tax plan like they do in Great Britain, and in that situation the physicians are employees of the system. The consumer response is actually better in the other countries than it is in our country with respect to the care that's received in those countries. And the interesting thing is, if you look at our country, if you look at Medicare, Medicaid, military insurance, TRICARE, and care for American Indians, 45% of our people are already on government plans one way or another.
45%?
Yeah.
Wow, I didn't realize it was that high, but yeah.
Well, there's 70 million people on Medicare, 57 million people on, 70 million on Medicaid, 57 million on Medicare, 2 million on the Indian plan, and there's not 9 million people on military health care and veterans care. Right. So if you add up all those numbers, it gets to be about 45% of our population. And at the same time, Medicare is growing at about 10,000 people a day. So, there are more and more people who are on plans that are in some way supported by the government now.
Okay, well, I want to go to the title of your book because I think that is really what we're all about. How are we going to save $1 trillion? My preference is Medicare for all, and I'll go into a little bit about that later on. But you have your own plan that you came up with your partner, and I'm like superbly interested in hearing exactly how this would work.
Okay. Well, what we did was we analyzed Medicare's cost segments, and we determined, the annual cost for Medicare is about $10,500 or something like that a person. So what we did is we looked at the cost segments of Medicare. We also felt that because 17% of our economy is involved with healthcare, it would be very difficult to simply eliminate the insurance industry. So we wanted to create an environment where the insurance industry could compete with a public option. And what we did was calculate that we could provide care on the Medicare schedule for people under 65 for about $4,700 per person per year for a single person. So we compared that number with the Carnegie Family Foundation that does a survey every year of the cost of insurance. And the average cost for single coverage is about $7,700 a year. So we figured out how we could reduce that by 30%. So for the 58% of our companies in the United States provide insurance that covers more than 150 million people. It's the largest coverage area. So we're saying if we could go to companies with a public plan, which in the book we called All Care. So if All Care could offer in the market coverage for $4,700 for a single person and save companies 30% of their insurance costs, if they all went to a product at that price point, how much would they save? And for those companies, they'd save $250 billion a year in aggregate. And we also calculated for the companies that do not provide insurance, we believe they should provide coverage for everyone. What would be the net impact on industry? And they would have to pay, for their insurance. So the net impact on industry, if everyone was able to buy insurance at that level, would be about a reduction of $175 billion a year. We also believe that we should have a single charge master for hospitals. If you break your leg, why does it cost more in one hospital versus another? Now, there should be adjustments for the cost of living in various parts of the country, but we believe because hospitals cost $1 trillion a year, we should be able to save about $200 billion a year out of those dollars. Because we want to remove bureaucracy, simplify billing, and eliminate the need for the large number of coders that exist. On average, large hospitals, 25% of their staff's involved with billing. So if we could simplify the billing process so that it could be more streamlined, that would be very helpful to hospitals and to doctors. Right now, hospitals and insurance companies and physicians, we spend 14% of our total healthcare spend on billing alone. In other countries, they spend 3 to 5%. So, that's another big area of savings if we could simplify billing and, make it a little fairer, and also eliminate hospital markup of their supplies. They should be able to mark up their supplies by a percentage for inventorying, but they shouldn't be able to mark it up as much as they do in some cases. So if you look at those things, plus the idea that some people think medical waste in our country for administrative purposes and actual product purposes is about 30% of our healthcare costs. There is a medical society, 80 medical societies that want to encourage physicians to save money on clinical costs. We believe physicians could develop savings in the range of $50 billion a year as opposed to $300 billion a year to help deliver the cost savings that we're talking about. So between those things and working to reduce the cost of pharmaceuticals in our country, we believe we could achieve savings of $1 billion to $1.2 billion. Now, if I'm off because these are very big, squishy numbers,
right,
we'll save $800 billion. Well, that's pretty good as opposed to.
Right. Now, let me kind of get in here to say this. I mean, one of the things that you pointed out in the beginning of your the beginning of your soliloquy right there was that given that we have the insurance companies entrenched already, it would be difficult to move forward. So I think in a lot of ways, and this is my biggest concern with healthcare reform generally, and that is we are trying to fit something into a defined model as opposed to trying to redefine the model altogether to fit what we need, what we want. So my question to you, why do we even need insurance? Why is there a need for insurance companies if we can simply say there is one huge risk pool, the American population?
Mm-hmm. Well, all of the other countries that you asked me about 10% of their markets are insurance companies, in addition to their Medicare for All or universal coverage plans. We think that competition is a good thing if you define it properly. What we're saying is we want to change the operating envelope of each of these segments, of the insurance industry, of the hospital industry, and the pharmaceutical industry as well. And we're saying that if we can provide a public option that costs 30% less than the insurance company option, they have to figure out how to compete with that at that price point. Also, in Medicare, people can buy Medicare Advantage. In our plan, we're saying we don't want Medicare Advantage to be in the basic plan. However, if you want to buy it, buy it.
On your own money.
Exactly. But that's an opportunity for insurance companies to compete in a segment of the market if they would like to do that.
And
so what we're... Go ahead.
Yeah, I like what you just said. I mean, I'm for that. I'm not for making private insurance companies illegal. I am for creating a basic tier of healthcare that doesn't need anything from a private insurance company. However, if you want petals on your bed and you want better food and you want, in other words, I'd like to have a baseline that we all are entitled to. And then if you want bells and whistles, you get a health insurance company. Otherwise, and I don't know that you've convinced me yet that there's even a need for health insurance companies for basic health care.
Well, what we're saying is because we like the idea of creating a very difficult competitive market, we're saying to the insurance company, okay, any company in the United States can buy insurance for 30% less than the average price in the United States. Mm-hmm. Can you compete with this? And I believe what would happen is some creative companies, I think particularly the Blue Cross companies, would find ways to compete with that because many of them are nonprofits, okay? And secondarily, insurance companies will say, we can't really compete in that, perhaps, or maybe they will if they get creative, but they'll say Medicare Advantage for all. For people under 65, that's a market that we could exist in. And it would change the size of their industry. It would get smaller, but it would be very specialized. The other thing is we're saying if you want concierge medicine, buy it. Just as you said, rose petals on your thing. Buy it. You want concierge, buy it.
Right. And that's where I'm with you. Yes.
The thing that we have to deal with in a very fundamental way is the physician shortage.
Right.
We need to make healthcare for physicians an attractive market. In our chapter that we wrote, Let Doctors Be Doctors, we discussed the idea that, burnout in physicians is very high. It's the highest in any profession in the United States. And now physicians spend more than 3 hours a week talking with insurance companies or writing letters to insurance companies to get the care their patients need. So, we also have physicians with incredible debt for going to school. There is an article that was in the Wall Street Journal about a dentist in the western part of our country. He went to a very prestigious school in Southern California. He had a lot of debt. And starting in 2007, there's a program where if you spend 10% of your disposable income on your debt, after 20 years, whatever's left over, can be forgiven, okay? But because of changes in interest rates, this guy's monthly payment is less than the accrued interest every month. He now owes more than $1 million. When his 20 years are up, he'll owe $2 million. And when it's forgiven, because it's counted as income, the IRS will say he got $700,000 in income, okay?
Right.
And there are 31 professionals in healthcare with the same problem, this one gentleman. On average, physicians get through that 20-year period, and they have to pay taxes on an additional $10,000 to $15,000. I think loans to physicians going to school should be at one flat interest rate. And I also think that if their loan is forgiven, they shouldn't be taxed on it at the end of paying for it for a long period of time. In addition to that, the American Medical College Association says in the next 5 years, we can have a shortage between 35,000 and 65,000 physicians. Between 15,000 and 35,000 of them will be primary care docs. And as it is right now, 30% of our physicians are over 55 years of age. Hospitals are now making physicians who are 70 or older take tests to see if they can continue to practice. So, and then there are parts of the country, particularly the southern part of our country, where women have to get C-sections because the obstetrician is 90 minutes away from where they live. And, infant mortality in our country is growing. It's worse than a lot of other countries now.
A lot of third world countries, yeah. Cuba has a better rate than us.
Well, yeah, Cuba has a plan to export physicians to other third world countries, which is quite successful. So, I think we have to address the physician issue, especially if we go to coverage for all, because as it stands now, we don't have enough physicians to cover everyone.
I want to kind of interject right there because I don't. People make the statement that you just made, and I don't see how they do it with a straight face. What I mean is when you say, especially since we're going for coverage for all, we're going to need a whole lot more doctors, which means right now we're saying our society suffices by having people just get sick and die because they can't see a doctor. I mean, it blows my mind when I hear that.
The Organization for Economic Cooperation and Development of the UN tracks 35 countries. This year went to 36.
Mm-hmm. Who was the 36th country? I'm curious.
I don't know. I didn't read the report. I have to tell you, I don't know. But in the report of 35, the U.S. ranks 33rd on graduating physicians. We graduate 7.5 physicians for every 100,000 people in our country. Mm-hmm. And I think the two countries behind us were Israel and Mexico.
Wow.
But everyone else, produces more physicians than we do. And I think part of the challenge is the cost of the education and, the feeling that a number of physicians have about the careers that they have. They want to help people. They want to treat people. We have great research in the United States. We have great cancer research and great stroke research. But in terms of delivering care, we make it very complicated based on the insurance system and the coverage and system we have today.
Yeah, I mean, and that is one of the reasons. It looked like we have a call. Let me just see if the person wants to ask you something, or is this for the other segment? Caller, you are on. Did you want to ask Dr. Eichhorn anything?
Yeah, this is Mike Cisak.
Yeah, Mike.
The question I've got for him is, out of all this stuff that he's talking about, one thing is still kind of missing, which we have for all other industries, and and that's really a visible price structure to where, we as consumers really never see a price because we're having third parties pay for all this stuff.
I mean, you're right about that. I've seen that. You've seen that too, right, Doctor?
Yes, actually, in our book, we do discuss pricing and having one charge master for all of the things people can be billed for to simplify hospital billing and, the statements you might receive from an insurance carrier or from the government if you have government coverage. So we agree that needs to be done in a much better way. In fact, today, in many hospital bills, there are errors because of the complexity of the bill. We think that's important too.
I thought you mentioned that earlier, that you had this list when you created your Healthcare for All bill that actually listed for, but I think you were listing it for the competitors, not necessarily for the clients. Is that right?
Well, in the book, we listed it that way, but we call for 4 major things to be done, and one of them is a standard charge master for all charges, in the country, so that people can see what everything costs in a much simpler way on their bills.
Gotcha. Anything else you want to ask him, Mike?
Well, see, Medicare actually has a charge schedule.
Yes, it does.
And that's the thing. I mean, in the private insurance, it basically goes off of that schedule. Now, why wouldn't we just make it to where hospitals and doctors and everyone put up publicly their pricing? And then people can come in, they can take a look. And see, the problem is, really, I mean, no matter if it's insurance or, a charge master or single payer or, Medicare for all, the consumer is not in charge. See, if the consumer was able to go in and look, because like 95% of care really is just it's on your time. Basically, it's not emergency. It's not any of that kind of stuff. You can actually wait a little bit. Okay, so people are able to shop around, and if people were able to shop around, they say, "Hey, insurance, I've got a better deal for you."
Okay, Mike. Let's answer the shop
go
around.
Over here.
Let's answer the shop around thing, Mike, because I'm curious about what Ed is going to say about the shop around. Is that a really feasible thing? The consumer really is it? You see, I've never found a consumer knowledgeable, including myself as a consumer of healthcare, to be knowledgeable enough to really do this shopping around thing. What do you say?
Well, I think the way consumers shop around for healthcare is they talk to their family and friends and ask them, who would you go for whatever my problem is? And usually in that format, people will say, gee, I went to this doctor, he did a great job, took care of me, I'm much better. I went to this other, facility, and I really wasn't happy with it. I think you ought to go to X instead of Y. What we're saying is if we have a one charge master, you could shop based on quality and convenience and availability, as opposed to being concerned about price, because the price would be pretty much the same everywhere.
So I mean, I think that is sort of a middle ground between what you were saying, Mike, because again, in effect, he's talking about a standard pricing, and then everybody else are trying to beat that.
Yeah, that's
sure.
Correct.
I mean, if they have a for each website for a hospital. If they want to put all their prices up, hey, great.
Yeah.
They ought to have feedback. They ought to have, and most of that's out there for most businesses. And people need that in order to feel, okay, hey, this guy's got a lot of good feedback. He's really good. And he would take a lot of demand and so on. And they would have the prices out there. So
go ahead.
When I think about that, Mike, I think prices are very important because we're talking about economics, but I would want to know what the infection rate is for the hospital. What's their success rate with the procedure that you might need versus the procedure at another location? So that you could say, okay, it's really, prices are sort of the same, but the heart surgery at hospital A is a little bit better than hospital B, or the infection rate is better at hospital A than hospital B. And if we publish that kind of information to every hospital, I think hospitals, although they're very concerned about it now, would want to make sure they have great data, because you're not going to want to go to the place where you think you're going to get an infection.
Right.
Now, Ed, what you just said, and that's where I think there's some intersectionality with what you're saying, what I believe in, and what Mike is saying. And Mike, can you believe there's some intersectionality between you and me?
Yeah.
Yeah, that's go ahead.
Like for example, I mean, if for 90% of what you need, if you go to a direct primary care cash only doctor, which is really growing, and there's no pre-existing condition problem that they have either. A lot of doctors are going for cash only because they're tired of the insurance companies, they're tired of the government bureaucrats and all that kind of stuff, and so that part, that's and they have their prices up front. A lot of healthy people, they could have a primary cash only doctor for $50 a month and catastrophic insurance for maybe $100 a month, and be a hell of a lot cheaper than any other single payer
I heard that so
has
often.
been mentioned.
Mike, I hear that so often, but I don't think that is realistic.
Which is factual.
Well, I tell you what,
it is.
Let's talk about that a little bit later, because I told Ed it was going to be a half hour, and we're about to cross that limit. But I'll hold your call. But let's continue to explore that, because that is very important. I wanted to say one thing, talk to you about one other thing before we go, and that had to do with we're talking about the shortage of doctors, et cetera, and tell me about it. Don't you think that we really should be subsidizing? You already are pointing out that we're going to be short 35,000 doctors. There are two solutions to that problem. One is, I know what the first solution is, and I know that's what our corporate structure is probably going to want to do, and that is that we're going to raid China, India, and all these other countries for doctors. And given our pay structure, I mean, it's probably what's going to do is probably bring down the average salary for the doctors that work here. First of all, do you agree with that or not?
Well, I think doctors do work to come here from other countries and have for many years. I think the problem on a medical school basis is how long it takes for someone to graduate from medical school, and then how long it takes for them to get comfortable in their own skin as a physician in their area of practice. And I think doctors may come here from other places, but we need to have more internships. We need to open that up. We should find a way to finance education. NYU announced last year that everyone in their medical school is going to go to school tuition free. Well, that's a great thing if you have an endowment that allows you to do that at the university of choice. But I think we need to restructure how we pay for that. In other countries, in Germany, for example, and I believe in France, physicians do not have bills for their education. And therefore, their income can be a little bit lower because they don't have to pay for the education they got.
That's what I'm talking about. That is what I'm talking about. Well, it's interesting. My sister is helping form the new, I don't know if you heard of Kaiser Permanente creating a new medical school. Yeah. Well, she's a dean that's recruiting, and they're giving 48 students a free medical degree for, I don't know if it's permanent or not, but I mean, these first 48 are coming in for free medical education. So it's wonderful. But look, Ed, give me a closer. First of all, I enjoyed speaking to you, and I enjoy what your plan has to offer. It's not Medicare for all, but it's the closest thing to bring some sanity to our healthcare system. I mean, I'll still first go for the Medicare for all. I'd like no questions asked. Take a card. Go. Can you give me 2 minutes?
Well, basically, what we're proposing could be a vehicle to Medicare for all. If insurance companies are not interested in competing with what we called all care in our book, care for everyone under 65, in a national plan that's really paid for by insurance premiums from companies, right? Basically, it's not really a tax. And also, all the taxes from Obamacare are not necessary in our plan. We don't need to tax people that make a lot of money, over 200,000. We don't need to tax people that make medical devices. The taxes that would come into play next year for pharmaceutical companies are simply not necessary under our plan. The other thing that I wanted to say that we didn't get to is if we require all of our employers to pay for insurance, that takes 16% of the people off of Medicaid immediately, and their family members. That would save the government $138 billion a year. So what we're saying is our plan allows for a compromise between the left and the right. The people who are now running for president want health care for everyone. And the people on the right want to reduce the cost of government. And what we're saying is our plan does both. So why don't we give it a try? And, that's where we are. That's why we think it's a reasonable plan to think about. That's what we spoke about in our book. And, we think it would actually work if we could bring people together around a plan that both saves money and provides coverage for all and actually improves quality along the way. So that's where we are.
I have no doubt it'll do that. Ed Eichhorn, thank you so kindly for having been here. Ed is a director or the founder of Medilink Consulting Group and the author of Healing American Healthcare. Please go get that book. You can reach it on our website, politicsdoneright.com, in the blog for this show. Thank you so kindly for having been here, my friend.
It was a great pleasure. I'd love to speak to you again in the future.
Absolutely. So you have a wonderful day.
You as well.
Folks, that was Ed Eichhorn. Look, like I said, we are going to continue to touch on these subjects, these very important subjects going forward. I mean, we are going to give folks that time that they don't get on mainstream media. We're going to make sure that we keep our people informed to what's going on and the options that they have out there. As you know, Mr. Eichhorn doesn't necessarily believe in going straight to Medicare for all, but he does provide a great ramp for Medicare for all, and he ended with a very important statement, and that is, hey, this could be a bridge. This could be a bridge. Anyhow, folks, before I go any further, I need to remind all of my great people that this is a progressive show that needs your support. Please go to patreon.com/politicsdoneright. Again, that is patreon.com/politicsdoneright, and subscribe to our progressive program. Support progressives by supporting Politics Done Right. As a little kind of a incentive, anyone who subscribe, as I'm writing the book, How to Make America Utopia. How to Make America Utopia. Those chapters are, Chapter 1 and Chapter 2 is written. You can read it online. All those subscribers can read that chapter online. Like now, I'm working on Chapter 3. All my books will be online for you to read for subscribers as well. Do not forget, As I See It, Class Warfare, the only resort to right-wing doom, is already online, and anybody who subscribes actually has access as well to As I See It, Class Warfare, the only resort to right-wing doom, online. Folks, that was an important subject. I want to thank Ed Eichhorn for being here with us to explain his plan for healthcare. And let me tell you, I'm a strong advocate for Medicare for all. I'm a very strong advocate for Medicare for all. But I also am a strong advocate for what works. And if his plan, which based on what I've read in his book thus far, it's plausible. I still think Medicare for all, by definition, given that it has no profits for insurance companies, cannot be beat. But for political reasons, if we have to go that direction first, I am actually willing to go there. Beforehand, I still have Mike Cisak online, and before I go into the subject about the who to vote for as far as progressives are concerned in the Democratic primary, let me just let Mike Cisak finish what he had to say. Mike, you want to go ahead and continue on the healthcare thing you were talking about?
Yeah, just real quick. Basically, what a lot of people I think miss is if you want to empower customers as far as what they need and what they want,
right,
they need to know what they're paying for.
I agree.
Because if they think it's too much, then, they should have the choice to be able to go somewhere else. Well, single payer doesn't do that. The insurance model doesn't do it. The current system is just, it's a third-party payer system that removes the power of the customer.
Let me tell you, look, I can't disagree with what you're saying there, Mike, but let me tell you where we differ here, right? I think you still view health care as a product, right? You still view something as, and that is my problem with capitalists, right? They view everything as, I'm a free enterpriser. I'm a democratic socialist who is a free enterpriser. Democratic because it's what the people want. Socialist because it is Social Security, Medicare, and all of it. That is the socialist part of democratic socialism. And people have a tendency to say, oh my God, it is communist. No, it is not. But anyhow, so my thing is this, however. There are certain things I don't believe belong in the market, my friend. And I don't think healthcare, in other words, I don't think you having to shop around for healthcare is something that we should have to worry about. I think healthcare is, as a country, we should want people healthy. And whatever it takes to do that. You walk into a doctor's office, there should be standard rates like Ed Eichhorn was talking about and like you spoke about as well. Well, you didn't speak about standard rates. You spoke about printed rates that the customer has to go and the patient has to go around and shop around to get the best rates that he can find or he or she can find. Is that right?
Mostly. I mean, if you go into a grocery store, the prices are all over there. They
Right.
you can, not everyone's going to get the cheapest thing.
True.
So, honestly, it, like I said, that's what I'm basically saying.
I got it.
So
But I think
I
it's
appreciate it.
And look, I appreciate your call. And I just want to say one thing before you go real quick.
Yep.
I think my thing is it's where your values are, right? Mine is that I don't think somebody who is sick or who has a health problem need to shop around. But thank you so kindly for calling in, Mike. And you should call in more often, man. All right?
Okay.
Take care, buddy. Okay, look, today I am going to be talking about our good old, what again? Check this out. Check this out. Which Democrat do you want? Which Democrat deserves your vote? Which Democrat is going to really uphold progressive principles? I am looking behind me, and let me move around so you can see some other candidates, right? I'm looking around, and I'm seeing all these candidates on the screen. And the one thing I see missing through most of those candidates, there are a whole bunch of Democrats, but I can only see two levels of Democrats there. And that is Democrats who would support or toe the line of what I call neoliberalism, but we don't have to go that far, or those who really want to say, no, it's time to give the middle class a break. And unfortunately, on this screen behind me with all those candidates and potential candidates, there are only 2.5 so far. And notice I said and a half, and that is because I'm not so sure. Well, I'm going to say 3.5 because there are 3 of them that I'm not quite sure about right now. But as far as I see, the only progressives who have toed a progressive line, who have said they are going to do the things necessary to really bend the curve and take back what was stolen from the middle class and the poor, is Bernie Sanders and Elizabeth Warren. I am not yet sure about Beto O'Rourke. I'm not yet sure about Merkley. I'm not sure about those 2 yet. I've already heard Sherrod Brown come out and say specifically that he's not for Medicare for all. It's unrealistic. And of course, we know Bloomberg back there and the guy from Colorado back there. And of course, we know the guy, the President Obama's, Attorney General, I can't remember his name right now, that is behind me as well. So the only 2 people, or 2.5 people right now that can earn my vote at this, or that can get my vote. They can all earn my vote depending on how their values come across during the primaries. But the only folks right now that can earn my values right now is either Elizabeth Warren or Bernie Sanders. Some may ask, why not Kamala Harris? She spoke about Medicare for all. Yes, she did, and she even kind of spoke about getting rid of private insurance companies, but not her confidant, but the person next to her, soon after that, backtracked and said she doesn't necessarily mean that. What about Villaraigosa? I think that's his name, the guy from LA. I'm not sure about him either because he hasn't made himself clear. But the ones that I'm very sure of that I don't think should earn a progressive vote at all has to do with Klobuchar. Why not Klobuchar? Klobuchar just said plain out, we can't pay for college tuition for folks. No, we can't pay for health care for everybody. We can't do it. She was very emphatic about that. We can't give things away free. Nothing is being given away free. These people will pay for this through the taxes that they pay for the next generation. That's what we do with Social Security. That's what we do with a whole lot of things. As I said several weeks before, or several days before, somehow it is always easy for us. If tomorrow Donald Trump said we need to go to war with Iran, I can almost guarantee you that nobody's going to say how much it costs. None of those senators behind me, bar Elizabeth Warren or Bernie Sanders, are going to say, wait a minute, how much does it cost? They immediately are likely to support a war. They never have problems about supporting wars. They never have problems supporting issues not related to social programs, which is the well-being of every American citizen. They never have those problems. It is time for us to look at solving our own problems as a war. It is up to us to do that. And we start by electing the right people in these jobs. We don't start by towing the party line. Or, well, we can't. Or we don't start by what we think are the only possibilities. We don't sit back and say, wait a minute, I don't think we can attain that. I don't think we can do that. The will isn't there for that. No, that is a lazy attitude, right? The reality is to get what we want to get takes work. Because the other side, the misleaders, are working 24/7. Those that are making your brothers and your sisters think the way they do, which is anathema to the way you think, there are other forces working on them. Why do you think it's going to be any easier for you? For us, for progressives, it won't. What we have to do is decide on our candidate, bold-faced, immediately, soon. Like right now, my litmus test is Medicare for all and a true progressive agenda. Pay it forward college. At least, and notice I said at least $15 an hour minimum wage. It really should be $21. And people say, oh my God, we can't do that. If you extrapolate what the minimum wage should be when McDonald's was paying minimum wage back then and how much their value have increased thus far, minimum wage should be $21 an hour. And you may say, but wait a minute, what's that going to do with business? It means the shareholders will not be getting those rocket high dividends, and those stock prices won't be going rocket high. But why are they doing that anyway? Those are passive income. They're sitting on their butts doing nothing as they collect passive income. Why should we wonder or be concerned that they are not getting a 7% return? And in order for them to get a 7% return, we have to starve the people who work for us and put those people who work for them on welfare so that all of us then pick up the tab so that a few shareholders can amass a fortune that then we don't tax as property, while you who own a home, you who own a car, you who owns much more have to pay a wealth tax on your car, a wealth tax on your home, a wealth tax on just about everything that isn't what the rich person owns. Look, it is time now for us to start doing two things. Dividing these candidates into progressives, potential progressives, or not progressive at all. Right now, most of them are in the boat that says not progressive at all. Secondly, the next bank is maybe progressives, and I put guys like Beto O'Rourke in there, and Hippenlucker. I am not sure about him because I think he has some issues. Merkel, yes. Elizabeth Warren, yes. Bernie Sanders, yes. In the progressive ones that are almost qualified already. The absolute no votes, Klobuchar. Absolute no votes. What's his name? Sherrod Brown. I mean, he came out against Medicare for all. Impossible to support anyone right now who does not come out for coverage for every single American. Period. Bar none. It is unethical to do that, especially in these times, especially what we've gone through all these years. So, my leading candidates again, folks, and for those who have just joined us again, is going to be Bernie Sanders and Elizabeth Warren. And maybe if Beto keep on his progressive mantra and comes out. I spoke to Beto, interviewed Beto when he came to Houston. And Beto went through hoops. Not to say he was for Medicare for all, but he has an open mind for it, and if it's the most efficient one, he is for it. I heard it. He told that to me, and he told that to the thereafter to the group that he came and met out here in Houston. So as I saw him campaigning throughout the country, like I was speaking to somebody else earlier today, I saw a candidate who was growing into progressivity, if that's a word, into progressiveness. I saw a candidate who saw the light. I saw a candidate who was behaving his age and realizing that crap of Reaganomics is no longer viable. That crap of supply-side economics is no longer viable. That crap about bringing down, that something trickling down to the average person is no longer viable. It was never viable, but many just had to see the results to really know that it wasn't viable, right? Every time you hear these people talk about tax cuts, every time you hear these people talk about leaving the markets to themselves or letting the market perform, all you have to say for all practical purposes, been there and done that. If you take a complete look at our economics since 1980, since Ronald Reagan, neither Obama nor Clinton changed the trajectory of trickle-down economics. It still remained that we took care of the wealthy first, with the expectation that everything will trickle down. Even the tax cuts that Donald Trump gave, he first gave it to the wealthy. He gave peanuts to the middle class and the poor. And guess what happened to a whole large segment of them? In the process, he said, okay, I'm going to take away all these. I'm going to give you a tax cut. Boom, you get a tax cut. But then I take away all these deductions. That plumber, that electrician that could deduct some of these items can no longer do it. So that tax cut gets eaten. But they didn't tell you the other ways that the tax cut got eaten, right? And there are many other ways the tax cut got eaten, but they didn't tell you. Because of less subsidies, because of all these other types of issues, guess what happened? Your costs for health care went up. Your costs for a whole lot of stuff went up. So it was yet another way to shovel your money to the owners of those companies who charged you more. And that is exactly what happened. So your health care went up and all these other things went up. So that little tax break that you got disappeared. That little increase in wages, that point-something% increase in wages that you got, disappeared. Okay, I think it's better. It's time for me to go ahead and read some of what people are saying here online. Let's see. Karen Andreessen, welcome aboard. Daniel Ledoux, welcome aboard. Mike Cisak, I just spoke to you on the line. Okay, let's see what she has to say. But beforehand, let me go ahead and... Okay, Karen Andreessen, we also need progressives to support authentic public education, not charters. Absolutely so. education belongs in the commons. It cannot be profit-based. It should not be profit-based, because if it's profit-based, it means that they have to cut corners to maximize their profits. Don't ever listen to what they're saying. Oh, competition. These guys think that competition can solve every problem. Competition does not solve every problem. Market-based education is a total lie. I agree. Politicians work with the wealthy to drain public schools dry to make them collapse. I actually agree. The objective is to privatize education. You're correct, Karen Andreessen. Daniel says, so just pass the cost of to the next generation. This is, that's what we've done. That's what Reagan did. That is what Reagan did. Reagan passed all the costs, all the things that we were living on pie, air pie. That's what we were living on. And we passed those trillions down. Remember, Reagan is the one who started exploding with these big, huge budgets. Don't you ever forget that. Reagan is the one who started the huge budget deficits. And yes, he passed that on to the next generation. When Clinton came with raising taxes, he didn't clear the deficit, or rather, he didn't clear our total debt, but he brought our deficit down to zero. Remember that. That Democratic president, who I'm not necessarily fond of, but he did that. Okay, Mike Cisak, I am a strong believer in what works. Single payer, that kind of scrolled off. Reagan taxed Social Security. Yes, he did, Rene Perpetua. He did tax Social Security. It looks like I have to go to another screen so I can read more comments. All right, I am back to the screen. It seems like we're on that minor delay, but let me go ahead and try to get to some more comments here. Okay, let's see. Oh, Bobby Jean, welcome. Love facts. Yeah, Bobby Jean, we should all love facts, right? Let's see what else we got here. Let's expand the horizon here so that I can see more things. Okay, we have... most people don't have time to shop around, and that's what I was trying to explain to El Senor. That is what I was trying to explain to Mr. Cisak, and that is, when you're sick, you got a cold, you got a cough, you don't want to then sit down with a yellow page and, the yellow page shows my age, right? Sit down and go on the internet and try to figure this stuff out. Not at all. Okay, let's see. No, it was Bill Clinton who taxed Social Security. Actually, I think it started under Ronald Reagan, but since I'm not 100% sure, I won't argue the point with you, Mr. Cisak. Okay, Bobby Jean said most people don't have the time to shop around. She's right. Bobby Jean also said love facts. Mike Cisak, so let's have a complete government monopoly and Medicare for all, right, Egberto? Yes, I want a monopoly on Medicare. I don't want to have any insurance companies in our lives, and I think most people would agree. Sure, we want kind of competitive choices for parents and their kids. It's not that we don't want competition. It's just that competition doesn't work in that domain. All right, let's see. Strong believer in what works? Yes. So if you want everybody to be middle class, does that justify anything to obtain that goal? Why do you ask the question that way? No, it's not that I want everybody to be in the middle class, but everybody works hard enough to be in the middle class, and as such, they should be. Daniel Little, what if I don't want to cross that bridge? Then don't cross that bridge. Nobody's begging you to be in the middle class. I mean, normal people would want to be at least in the middle class, but if that's not you, more power to you, right? Nobody's forcing you to do that at all. Nobody at all saying, oh, Mr. Senor, you must be in the middle class or else. Nobody's telling you that. Okay, we only have 3 minutes, so I have to do my last pitch, folks. Please, 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 if you're just joining us, please go ahead and go to patreon.com/politicsdoneright. That is patreon.com/politicsdoneright. Those people who subscribe to the show, remember the show, it's very inexpensive. It starts at $1.99. Those people who subscribe, of course, get access to the entire website, all the books that I have on the website as well. How to Make America Utopia. It's a book I'm writing right now. Chapter 1 and 2 are complete. Those people who subscribe can actually go online to egbertowillies.com, click on my books, and go ahead and read that book. We also have my other book, which is As I See It, Class Warfare, The Only Resort to Right-Wing Doom. That book, the entire book, is online now. You can read it online if you subscribe to Politics Done Right at patreon.com/Politics Done Right. That is patreon.com/Politics Done Right. Now, let me tell you better, folks. If you don't want to subscribe, you can also give a contribution at politicsdoneright.com. Just go to the PayPal button and contribute to the show. Remember, you're not going to see the kinds of programs that we have here. You notice the doctor got Ed Eichhorn got the entire 30 minutes to go ahead and make his pitch about the healthcare plan that he wrote about. He and another doctor wrote about that actually is it's implementable and it's possible. I mean, it's not Medicare for all, but it's an option. And it's much better than what we have now, and it covers absolutely everybody, and it really does, based on his calculation, drop our price by $1 trillion. Why wouldn't we do it? If we can't get Medicare for all, why don't we start there? But I don't want to talk about starting there because I want Medicare for all. But again, there are other options out there. Look, we're coming to the end of the program. My name is Egberto Willies. This is Politics Done Right, and you know how I end this baby, and it goes this way. I am what? Out!
Welcome to Politics Done Right. I am your host, Egberto Willies. This is the progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, conservative, or otherwise, you get to air your point of view. Remember, you can also send me a tweet to EGBERTOWILLIES. That is, at Egberto Willies. Let us engage. It is Politics Done Right.
1, 2, 3, 4.